For lab this week, we are going to be covering the elbow. So remember, the first thing we want to do when a patient walks into the athletic training room is we want to observe them. So as Cole was walking in, I'm looking at his arm. You can even look up into the shoulder, down into the elbow, and distally in the wrist. Notice any obvious deformities, if there's any ecchymosis, edema, anything that I would think is worth noting within my SOAP note. From here, I'm going to always start the patient out in anatomical position. So I'm going to place him with palm up, and then I'm just going to begin with the bony palpations. On the medial side of the elbow, we have the medial epicondyle, so that's the distal portion of the humerus here. Just on the opposite side of that, we have the lateral epicondyle. On the back side of the arm, we have the olecranon process, so that's just that large bony protuberance that extends off the ulna. Next, we have the radial head. So remember, the radial head is proximal to the humerus, and that's just going to be on the thumb side, just below the humerus here. And I can actually feel that as I pronate him and then supinate him. We can feel that the radial head is spinning over the ulna. Remember, the annular ligament is what holds the radial head in place as he is pronating from full supination. Next, we have our soft tissue palpation. So I'm going to start a little bit more proximal. We have, again, the biceps. Just inferior to the biceps, we have the brachialis. I'm going to put him in a thumbs up position, so can you stick your thumbs up? Good. Right in here on the radial side is the brachioradialis. Next we have the wrist flexor group and the wrist extensor group. So remember, back to anatomy, the wrist flexors stem off of the medial epicondyle, whereas the wrist extensors stem off the lateral epicondyle. Next we have the ulnar collateral and radial collateral ligaments. So just as the name suggests, the radial collateral ligament is going to be on the radial side or the thumb side of the wrist. So the RCL is going to be right up along the elbow joint line on the lateral side. The ulnar collateral ligament is going to be on the medial side, and that's the ligament that's often damaged in little leaguers, and they use the palmaris longus tendon to repair that ligament if needed. On the posterior aspect, I'm actually going to have you stand up and turn around for me. We have the triceps. So we have the three heads of the triceps here. Along the distal portion of the posterior aspect of the humerus, we have the anconeus. So the anconeus helps with the last couple degrees of extension. From here we have the olecranon fossa, so that's going to be just superior to the olecranon process. It's going to be a small opening right in here. And then on the anterior side, go ahead and turn around, we have the cubital fossa, so that's just going to be right in here. And so that's typically where you would get an IV if you were in the hospital and things like that. So that's all that we have for our palpations. I did want to review the wrist flexor group from anatomy, so I'm going to ask Cole to make an L with his left hand, and I want you to bring it towards the inside of your wrist and just spread your fingers like that. Good. So remember, back to anatomy, as we have our wrist flexor group, we can identify them based on these four fingers. So the most superior is our pronator teres. The next one is pointing to the radial side of the wrist, so this is the flexor carpi radialis. Our ring finger is pointing straight down the center of the palm, that is the palmaris longus. And then the pinky is pointing on the ulnar side of the wrist, so this is the flexor carpi ulnaris. So remember, in anatomy we talked about PF, PF. Think about those different acronyms that we talked about in anatomy so that you don't get confused when we're thinking about the wrist flexors versus the wrist extensors. Remember, the wrist extensors, go ahead and relax, are stemming off the lateral epicondyle of the humerus.